Hello. Where you have a relative who is in a care home in a particular clinical commissioning group's catchment area, moving them to a different clinical commissioning group catchment area can present some issues. Now, the national framework is quite clear, as it often is, that the original clinical commissioning group bears the responsibility of the cost of care for the individual should they latterly move into a different catchment area. Now, the problem can arise in the fact that despite the fact this is what the national framework says, whether it's indeed adhered to by the clinical commissioning group in either area. So, for example, the departing clinical commissioning group may refuse to accept it's their responsibility to meet the costs of care of the individual, and indeed the new clinical commissioning group catchment area may refuse to take on the individual's case, if you like, because they feel correctly that it's the responsibility of the previous clinical commissioning group. Clearly, as with everything, the patient should not be prejudiced by the actions of the clinical commissioning groups or the NHS, but unfortunately this is another example of the sort of issues that can occur and why it is necessary to know the process and be able to argue and deal with the clinical commissioning groups to point out their obligations under the national framework as to what they should and should not be doing. Now, sometimes people are appealing a DST in one area and due to particular circumstances feel it's necessary to move, unavoidable to move the patient into a different area. It's not ideal, and obviously for the we would suggest that given the potential issues that can arise, as we've highlighted, if it can be avoided, then you may save yourself an argument and a future difficulty. However, the national framework makes it clear as to what the position should be, and therefore you do have that to fall back on if it's necessary to challenge the NHS. What it comes down to is whether it's absolutely necessary and what your process is, and we may be doing the particular clinical commissioning group a disservice, and it may well be that your transfer to a different area creates no issues at all. So it entirely depends on the particular case and the particular circumstances. What we would suggest is that often it's for the sake of an easy life, so we say, it may be better to, rather than complicate matters, if it can be the case that an individual who is receiving funding for continuing healthcare funding can stay within a particular catchment area, then if it's a choice between the two and there is no difference, that may be a factor that sways it in favour of remaining in a particular clinical commissioning group to avoid a further debate. Thank you very much.